So someone wanted to know, how does a vertebral artery dissection cause a Horner syndrome? And that's a very interesting question. But before you answer that question, you need to know the entire sympathetic pathway for the eye. So it starts in the hypothalamus, it descends posterior laterally in your brainstem, and goes all the way down to the thoracic T2, C8, T2 level in your spine. That is the first order neuron. So any lesion along the first order neuron could produce a Horner syndrome. The second order neuron exits white rami, goes over the apex of your lung, ascends up the sympathetic chain. So passes through the inferior cervical ganglion, the middle cervical ganglion, and then synapse in the superior cervical ganglion, which is about at the level of your jaw here. That is the second order neuron. Once that occurs, then it wraps onto the internal carotid artery and travels into the cavernous sinus, onto cranial nerve number 6 for a very short period of time in the cavernous sinus, and then onto cranial nerve number 5 to innervate the eye and the eyelid. So it should just go straight across to the eye like this, but it doesn't. It goes all the way down here and then all the way back up. So in the carotid dissection, the carotid artery dissection, it's so obvious why you have a Horner syndrome, because the sympathetics are directly wrapped around the carotid in that location. So the sympathetic fibers are disrupted by the tear in the false lumen in a carotid dissection. But in a vertebral dissection, we have to pick somewhere along this pathway where the vertebral artery dissection could cause the Horners. And because the sympathetic is not on the vertebral artery, it's counterintuitive that a Horner syndrome could occur from the vertebral artery. However, it's not the same mechanism. So as opposed to the carotid, where the sympathetic nerve is being directly damaged by the expansion and the false lumen in the carotid dissection, in the vert dissection, you are having lack of ischemia to the part of the brain stem that is supplied by that vertebral artery. So as you remember, in the circle of Willis, you got 2 vertebral arteries. They become the basilar artery, and the terminal artery is the posterior cerebral artery. This is the posterior portion of the circle of Willis, and there are branches coming off that basilar artery that supply your brainstem and cerebellum. So you've got anterior inferior cerebellar artery, posterior inferior cerebellar artery, superior cerebellar artery, and these little perforators supply your brainstem. So for example, if you have a posterior inferior cerebellar artery infarct, pica infarct, you will be knocking out some of the fibers in the medulla, and that thing is called the lateral medullary syndrome, and it produces the Wallenberg syndrome. So one of the components of the Wallenberg syndrome is a lateral medullary lesion will disrupt the posterior lateral descending primary first order neuron, and that will cause a Horner syndrome. So the reason you need to know the vert dissection and the carotid dissection both cause Horner syndrome is because that's how it presents to ophthalmology. But the vert dissection's Horner is from ischemia to the actual first order neuron, and in the carotid dissection, it's from mechanical disruption, the actual sympathetic fiber wrapped around the carotid in your neck. And that's why you need to know both dissections for the Horner syndrome.